Hello everyone. I'm going to demonstrate a new tool that is available in the latest ScanFlow acquisition software called Keep Selected Area. This tool will allow you control over the refinement stage. I'm going to demonstrate this tool using this case. Very briefly, this is a cancer patient, very difficult to scan because she's lost all of her lower teeth here. There's no bone remaining. She has an overreactive tongue and inflammation that wouldn't allow anyone to take a physical impression of her. You see here, these white things are actually mirrors, plastic mirrors, attempting to keep her tongue from being in the scan. And of course, there is the artificial intelligence arrow, which you should always do your best to resolve by scanning over, which is there to indicate that there's going to be a problem when it goes to the check step, the refinement stage. So you want to definitely do your best to resolve this. In this case, again, very tough scan here. When it comes to these edentulous areas, we have to stitch these the proper way. So let me show you what was happening to the office. I'll also tell you briefly that when the lab looked at the raw data, just like I was showing you, they were more than happy to receive that and be able to work with it. They could go ahead and proceed to fabricating a removable that would allow her to keep her front teeth in place and basically talk and chew. So it's a wonderful story, really feel good story. But the office that did the scan couldn't get past this stage because of what you're about to see momentarily. And there it is. So the algorithm thought that it couldn't keep all of this together because it wasn't stitched enough. There wasn't enough data down here on the mandible to keep it together. Well, now we have a way to deal with that. So let's go back and show you the raw scan. And again, just looking at it, hey, I have some tissue here. Why is it cutting that out? Well, again, it's lower data. It's not optimum. But sometimes, due to circumstances, you're not able to get the best scan. Now, you're able to go to this new tool called Keep Selected Area, the third one on the left here. Simply engage it by left clicking, and then left click and left click, left click, left click, double click on the last click, and encompass or highlight the area that's in question, that you're worried about refining out. Actually, in this case, I'm going to do the entire arch. So in essence, what I'm saying here is when I go to this refinement stage, I would like the arch to be kept completely intact, including the low data points. I don't want you to cut anything out, is what I'm telling the algorithm. I know there's an arrow there, and I know there's some plastic mirrors there, but I will clean that up myself because this is a very tough case, and I would like to keep it together in order to be able to get to the export stage, which allows me to send it to the lab as I see it in my raw scan data. So that's what this is about. Perhaps this has happened to you in the past. You've scanned something, you look at it and you feel it's there, but then when you go to this refinement stage, it's no longer there because it was, again, lower points of data. It wasn't the optimum scan. So now you're able to tell the algorithm, I know it's not the best, but I would still like you to leave it in there because my lab could work with it, or we can go ahead and proceed with whatever the prosthesis might be in that situation. So you can see here momentarily, they were absolutely ecstatic to be able to get to this stage, get past it, and go to the export stage. And obviously, the STL would have presented this way. And as I mentioned earlier, briefly, if I wanted to do a quick little cleanup myself, I could engage this left cutting tool up here at the top and left click, and do some fine cutting around here and get rid of those mirrors myself. Wonderful new tool that's available in the latest ScanFlow called Keep Selected Area. Hope this was helpful. Thank you for watching. Bye-bye.